Today we're talking hormones, midlife health, and Charleston event, bringing women together for conversations we should have been having all along, with Erin Straughan, owner of Tidewater Pharmacy and Compounding.
This is Charleston Women Podcast, where you can meet like-minded, strong, independent, professional, and inspiring local women. This is Charleston Women Podcast.
Hello, this is Kim Russo, your host of the Charleston Women Podcast. Today we're joined by Erin Straughan, a pediatric nurse, anesthetist turned pharmacy owner, and women's health advocate. As the owner of Tidewater Pharmacy and Compounding, she is redefining what independent pharmacy can look like, blending clinical expertise, community, and personalized hormones and integrative care to support women in midlife and beyond. Welcome, Erin.
Thank you so much for having me. I really appreciate it.
Yeah, so tell me how you started as a pediatric anesthetist and then it came into shifting to be a pharmacy owner.
Right. I mean, I think it's just the natural progression of CRNA to pharmacy owner. I like to call this one of life's really fun plot twists. Not something I saw coming, but I have been working as a pediatric nurse anesthetist for about 15 years, loved the career. So my background has always been deeply rooted in medicine. And then when the opportunity came to take over ownership of Tidewater, it was unexpected and extremely scary. And I wasn't quite sure I could do it. But then I just really realized that taking this over, it just deeply aligned with what I wanted healthcare to be, which was collaborative and personal and not a one-size-fits-all. And so I jumped in and I haven't looked back.
What did you see in traditional healthcare that made you realize something needed to change and create this pharmacy?
I think the biggest thing that I was noticing was that my friends and customers coming into the pharmacy, there were so many women coming in frustrated, saying their symptoms were being overlooked, saying that they felt awful and they were doing everything. They were doing yoga, 5 times a week. They were running, they were eating right, and they just didn't feel themselves. And the frustration came when their symptoms would be dismissed and they would be sent on their way. And then they'd come to us looking for any sort of supplement or something that would help them. And I thought, we can do better than this and we should be doing better.
Yeah. So how do you differentiate yourself? Do you meet with them? Is there an appointment setting? How does that work to really figure out what is right for them?
Well, first of all, we are a traditional pharmacy, so we take traditional prescriptions. But because we are a compounding pharmacy, what that means is that we have to work closely with the physicians and practitioners so that we can custom make a medication specifically for a patient. Our job really is to create a seamless timeline from the time a patient walks into their doctor's office to the time they walk in to see us. And then when they leave and they have to feel confident knowing exactly what they're taking, how they're going to feel afterwards. And we've built a place where we have 4 to 5 pharmacists on staff at any time, which allows us to take the time to sit down with patients, to go off into a side room and really talk about things. And I think integrating our holistic wellness and our supplements is also a big part of what we're doing. So with the exception of one pharmacist, who he's going to love the shout out, Corey, but with the exception of one, we're all women and we talk about this stuff in our own time. So it's a natural thing when women come in and are frustrated and we're like, oh, sit down. Let me tell you what I know.
In 1996, it was Southern Women to Women magazine. Now it's Charleston Women magazine. Charleston Women is all about strong, capable, confident, hardworking, nurturing, determined, dedicated, and inspiring women. Our readers are business owners, entrepreneurs, mothers, sisters, wives, and grandmothers. Pick up your copy of Charleston Women magazine at Charleston area Harris Teeters and Food Lions. Charleston Women magazine. We are Charleston Women.
You're listening to the Charleston Women Podcast.
One thing that I love coming in is your staff is always so helpful and so nice. Can you tell me a little bit about them?
I own Tidewater, but truly the magic and the heart is with that staff. I can't brag about them enough. They are not only the most dedicated team, but they truly care to their core. And they really thrive off of being able to sit down and talk with our customers and patients. And just the other day, I have to laugh at this story because I looked over and I saw, one of my staff grabbing their keys. And I said, well, Wanda, do you need something? Are you going somewhere? And she said, oh, well, Miss So-and-so, her delivery's getting ready to go out, but she really needs her Maybelline foundation, shade 312 golden. We don't sell Maybelline. And she's like, I know, I'm just going to run to Walgreens real quick to grab it for her. That right there just hit me so hard because she used her own money to buy this woman foundation, which was obviously not a necessity. That is at the heart of what we do. We are here to serve, and that staff pushes me to work harder and be better every single day. So I'm extremely grateful for them.
Well, as a personal customer of yours, I came in for compounding for progesterone as, in my mid 40s now and creeping up and having changes to my body that I didn't understand. It's really helped me to figure out why I was feeling these things and how to fix it. I didn't even know compounding was a thing until I came to you. And also, I started with the lozenges that had flavoring, and I found myself not taking them because of the aftertaste, and knowing and finding out from your staff that there's an alternative to that. So it's still compounding, but I've switched up to be better, to be accountable to taking my own.
That is important. I mean, that is the beauty. Compounding really is like a combination of art and science. And it's where we get to really collaborate the two things to create something that is not a one size fits all, but specifically tailored for a patient. And we do it for pediatrics and we do it for animals as well. We have beef flavoring and marshmallow, anything that we can do to make patients stay taking their medication.
When I come in there and I'm waiting, there's so much to look around and see. You're not just a pharmacy and you're not your typical CVS, Walgreens, all that type of stuff. So what is it that really makes Tidewater special and that experience that you're providing for customers when they come in? There's mushroom coffees and things and other supplements. So can you share with us a little bit about how you curated that?
Yeah, really, it's kind of like a weird deep dive into my schizophrenic brain. It's just pretty much all the things that I am really excited about or learning about. My favorite skincare, all these things that are coming into my Instagram feed and the things that keep coming into my reels. I want to know more about them. We do the research, and the things that we finally vet, we're like, all right, these are good enough to sell to our patients.
Do you have local products too?
A lot of our vendors are local, from elderberry to Edisto honey, and we have local jewelry makers that have their jewelry in our store. It's really important for us to support local business.
What are the goals and expansion? I think you mentioned that you are licensed now in more than 20 states.
It's really exciting. It's been quite the feat. But 23 states right now that we're licensed in. We have 13 more coming. And we've just launched our Tidewater Shopify store. So you now can get online and have access to buying all the things that we sell, or most of the things that we sell in the store are now available. And then the biggest thing that this is my baby and I'm so excited about, is we're getting ready to launch Tidewater After Hours. And this is an educational series that will be quarterly. And this is really focused on creating a space for women to get together and to have their questions answered and create community, and to have that place where they can have a voice and to ask questions. And we want them to feel empowered and in control of what's going on with their body. So March 19th is our first big event. And this is the kind of inaugural big party that we're having. And it's going to be at Harborside East. Already, it's been astounding and really exciting to see how many women, just in 2 days, 80 RSVP'd. And we're like, oh my gosh, we can only fit 200. I think that just goes to show women are hungry for this information. They want to know. They want for the experts to be talking to them. So we will have a panel of our local experts. Women will have the chance to ask their questions. And we're just going to provide a fun night where we can just provide a sense of community and get together and start talking about the ridiculousness of perimenopause and menopause, because there's no other time in your life when you can be hot and sweating and freezing in the same moment and crying and then furious all at the same time. And it's a real joy. And I just feel like better to laugh at the fact that our bodies feel like a, three-ring circus than not. So that's what we're doing.
I think we're privileged now to understand what perimenopause is. I don't remember hearing anybody talk about it, maybe because I'm in it. But I don't remember growing up, my mom talking about it. I come from, a world where you knew like there was depression and there was all these things, but you didn't understand how to fix it. Weight issues, things like that. And I think that we are definitely in an age where having the knowledge is really power and understanding. So what other things besides a panel can us women look for at this event that you're going to be having?
Okay, well, it's not just our panel, but we also are bringing in all of our like local partnered physicians, wellness, physical therapists that all cater to this time in life. And I think getting to meet the people in the community that are directly providing this care and knowing that you have like really powerful health advocates out there that are specifically here to take care of you in this time of life, I think is going to be huge. And you are so right. I mean, my mom, even still to this day, I mean, she's so scared of hormones. Nobody talked about it. And you just kind of like dealt with the fact that as you get older, you're going to get a little chubbier. You're not going to, sleep well, all the things. And I think it's really empowering to know that we can do something about it.
I mean, I'm even on testosterone now, and that's something I would have never thought that a woman could have access to or should be on. My boyfriend likes to joke that he went on it, or I went on it before him. So
I know, isn't it awesome though?
I can really tell when it's fading. I get tired and I can just feel my joints hurting.
Well, and then you realize you're like, oh my gosh, like I could take a simple thing as testosterone and feel remarkably better. Or I could have just like suffered through these like, you could say seemingly benign symptoms, but they're really not because it's cumulative and it adds up and it just creates this overall feeling of like, ugh. I have to laugh because I think if I were to walk into a doctor's office with erectile dysfunction, within 5 minutes, I'd be walking out with a prescription for Cialis or Viagra. But you walk into a doctor's office now and you talk about pain during intercourse or decreased libido. And so often are fed this narrative of, well, that's normal aging. And, have you tried things like yoga or relaxation, which I just think, how are we still here? How are we still having the same discussion? And so I think we can do better. And I think women are starting to figure this out. And there is chatter and there's talk. And I think the more we get together and discuss, the better and stronger.
Your event that's coming up, it's your first one, and proceeds are going to a nonprofit.
So this is really near and dear to my heart. It was a free event, but we are asking that donations be made directly to Palmetto Hope Network. And this organization is phenomenal. They work with women and children, give them transitional housing, education, all to help them escape domestic abuse. It's really important that we as a community really dig into outreach. And I think as a pharmacy, we believe in this. I'd like to think as a group of women also going through a transitional period in our life, I think it's really important to support all those going through transitional periods.
And if somebody can't make it to this one coming up March 19th, you mentioned you're going to be doing it quarterly. Do you envision it the same or different?
I think it's probably going to be a little bit more intimate. I don't think we're going to be able to get 200, 250 women out necessarily every quarter, but the goal is still going to be the same. The goal is to pull women in, sit down, have somebody that's the leader in their industry and start to talk about that so that they feel like they're empowered with the knowledge they need to make, the decisions on their healthcare.
And then as far as access, you mentioned Shopify and just building that out. Is that just the like supplements and things that you sell, or is it a way that people can access the compounding and prescriptions in those 23 states that you mentioned?
Our website, you can actively go on and refill your prescriptions. This site is connected to our website, and it just allows you the opportunity to buy the supplements. So we have the pure encapsulations and Thorn. I think Row is on there, and our integrative peptides, which are huge right now. And also a lot of our local vendors we've put on there because I think, again, it's just a really great way to support our local businesses.
You've said something really powerful, that midlife might actually be when women's biggest growth begins. What has this season taught you personally?
Oh man, so much. This has really been a transitional phase for me. And I believe that strength and ambition don't start to die just because you're aging. I think that you really start to know who you are and get comfortable in your skin. And so long as we can feel strong and powerful, I think that that's when some of our best work can happen. And I've been through a hard transition, a hard season. And what I've learned is that there's so much beauty on the other side of it. And really, Tidewater and having the opportunity to own this and have this outreach with women has been one of the most rewarding things I've ever done.
If there's any woman that's listening and they're not familiar with this and they know something's off and something's wrong with them, where would you tell them to start?
Okay, well, number one, girl, come on down to Tidewater.
Yeah.
We will sit down, we'll have a cup of coffee, and we'll chat. They can go to our website. There's information on how you can attend the quarterly educational series. But really, if you are struggling, gosh, there's all of us, our pharmacists would love to sit down and do a consultation with you, discuss what's going on, and really kind of, work as a liaison between you and your physician. Because really what we do is just a huge collaborative approach.
Yeah, that's much more personalized than you would get anywhere else.
Yeah. This is very true.
Well, where can listeners find Tidewater Pharmacy and Compounding?
We are in Mount Pleasant. We are right over the bridge next to Trader Joe's. So if you're waiting for a prescription, feel free to run next door and get some orange chicken. Our website is tidewaterpharmacy.com and Instagram is at Tidewater Pharmacy. So all of those places will have the links that, you can find all of our information on.
Yeah. And then when they're going to their doctor, they can just recommend that you be their pharmacist.
Right. And
you take insurance like normal.
We sure do.
Erin, thank you so much for joining us on the Charleston Women podcast and telling us all about your event that's coming up and Tidewater Pharmacy and Compounding.
Well, thank you so much for having me. I really appreciate it.
I'm Kim Russo, host of the Charleston Women podcast, and I will see you next time.
Thanks for spending time with Charleston Women Podcast. Please like us and follow us on whatever platform you're using to access Charleston Women Podcast.